Most of the times people look at the physical health, but the other important aspect that has been missing, it is the emotional status of our staff.
Unconsciously, sometimes you come in and you might not say anything, but just how you feel can kind of resonate and kind of rub off onto other people, maybe not just the staff but patients as well, and it can have a knock-on effect and a domino effect, and before you know it, things are kind of spiraling out of control when they don't really need to be.
At the start of the year we had a culture of care project that was ongoing and looked at our staff survey to see where we can make improvements for the year. And staff wellbeing was kind of top of the priority list, I suppose, and what we wanted to look at, acknowledging that if we supported our staff, we'd get better results for our patients.
Coming, we have handover, professional handover, which is basically just finding out what's been happening during the week, if there's any concerns or anything like that. And then we come in, we have like a board which kind of references what mood you're in. So people usually put their names to signify how they're feeling for the day. And then we'll have a morning meeting to kind of plan the day with the patients, basically.
If I'm on the red, I don't have to explain to anyone. People just say, oh, today he's not in his best, how do we support him?
We never ask anybody what's going wrong. We make people aware that I've seen where you are and we're here to support and talk if you need to and make adjustments if we need to. Part two to that is supervision. Supervision is really important for our staff members and it being meaningful towards them. At the end of every supervision, our staff will grade their well-being and their happiness being at work. And our goal as an employer, as a supervisor, is to achieve them one better. So if they grade themselves as a 6, we should try and get them to a 7, and we look at ways we can do that over the course of the month. So staff can sort of come to work and their colleagues know how much they're able to give on the day. So we worked on the premise of if we all need to give 100, who can give 50%, who can give 20%, etc., just to achieve that 100. Staff members that are going off because things are difficult, which is absolutely fair enough, felt able to return quicker because they knew that their colleagues would be, and their management hopefully, would be supporting them on their returns. We saw the really positive stuff probably, what time are we talking, September, October time I think, where we'd been there and said, oh, our sickness has dropped by 50% and our patient sort of impact in their PALS meetings and stuff was really, really positive, and there was lots of good stuff coming through. The work is definitely more challenging, I'd say, now than it was sort of 5-10 years ago, 10 years ago when I started. We're a rehabilitation ward, but we get more and more sort of acutely unwell patients, I'd say, so we're changing the way we work. There is a lot of challenging situations, and knowing where we all are is important, because if we don't support each other and make those sort of adjustments, then people won't turn up.
Proudest thing for me is coming to work in a team with the sole aim of trying to help people lead a better life in the future. I think for me that's there's nothing better than that for me, to be fair.
It's all the day of the team looking after each other, and that's the most important thing.